Glioblastoma multiforme, GBM, remains one of the deadliest brain cancers, with survival rates that have barely improved despite decades of medical advancements. Even with aggressive treatment, including surgery, chemotherapy, and radiation, most patients survive only 12 to 18 months. The stark reality is that current therapies are often ineffective in the long run, and recurrence is nearly inevitable. However, new research has uncovered a possible way to significantly extend survival: the ketogenic diet. A recent study found that GBM patients who adhered to this diet for at least 6 months had a 66.7% survival rate at 3 years, compared to just 8.3% among those who did not. This represents a massive difference. Yet the findings also highlight the challenges in getting patients to adopt and maintain such a strict dietary intervention. The study tracked 18 patients between 2016 and 2024, dividing them into 2 groups based on whether they adhered to the ketogenic diet. The contrast in survival times was striking. Those who followed the diet lived far longer than those who stuck to conventional treatments alone. While this suggests that diet could play a crucial role in GBM treatment, only a small number of patients were able to maintain the diet long-term. Many faced skepticism from doctors and family members, struggled with the restrictive nature of the diet, or found it too expensive. If the ketogenic diet has the potential to dramatically extend life expectancy, then the failure to implement it widely is a major issue that must be addressed. The science behind why the ketogenic diet might slow GBM progression is compelling. GBM cells are heavily dependent on glucose for energy, but are unable to efficiently use ketones due to metabolic dysfunction. By drastically reducing carbohydrate intake, the ketogenic diet effectively starves the tumor while allowing healthy brain cells to thrive on ketones. This metabolic shift not only deprives cancer cells of their preferred fuel, but also lowers inflammation, a factor that has been linked to tumor growth. Additionally, early research suggests that ketosis may enhance the effects of chemotherapy and radiation, making cancer cells more vulnerable to treatment. The potential benefits of this dietary approach are substantial, yet mainstream oncology has been slow to embrace it. Despite the promising results, adherence to the ketogenic diet remains a significant obstacle. The study found that men were more likely than women to maintain the diet, with only 1 out of 8 female patients following it beyond 6 months, compared to 5 out of 10 male patients. This gender disparity raises important questions about the social, psychological, and physiological factors that influence dietary adherence. Many patients were hesitant to try the diet due to skepticism, resistance from their families, or difficulty adjusting to such a drastic change in eating habits. Additionally, high-quality ketogenic foods can be expensive, making the diet financially unfeasible for some. These barriers must be addressed if metabolic therapies are to become a viable part of cancer treatment. For those willing to try the ketogenic diet as part of a GBM treatment plan, strict adherence is essential. This means consuming fewer than 20 to 50 grams of total carbohydrates per day while prioritizing high-quality fats, such as avocados, olive oil, and fatty fish. Protein should be consumed in moderate amounts from sources like eggs, poultry, and grass-fed beef. Non-starchy vegetables, nuts, and dairy can also be included, but sugar, grains, and processed foods must be eliminated entirely. Achieving and maintaining ketosis requires careful meal planning and, ideally, medical supervision to ensure nutritional adequacy. Patients considering this approach should consult with an oncologist and a nutritionist experienced in ketogenic therapy to develop a plan that supports both cancer treatment and overall health. While the ketogenic diet is not a cure for GBM, the evidence suggests that it could be a powerful tool in extending survival. The fact that such a dramatic difference in outcomes was observed in a small study should be a wake-up call for the medical community. Larger clinical trials are urgently needed to confirm these findings and determine how best to integrate ketogenic therapy with existing treatments. Additionally, more research is needed to explore why some patients struggle to adhere to the diet and how to make it more accessible and sustainable. If dietary intervention can provide even a modest survival advantage in a cancer as aggressive as GBM, failing to explore it further would be a critical oversight. The challenge now is ensuring that patients are given the opportunity and support to incorporate metabolic strategies into their treatment plans before it's too late.